Show me your meds is our way of looking at every single person we see, what medication they're on. We phrase it because literally that's what we ask. Show me your meds. Would you show me your meds, please? We can look at then, are they taking them? Why aren't they taking them? Does that mean that there may be memory issues around not taking the medication? Do they need a blister pack? But also in the knowledge that a blister pack doesn't solve the memory. So a medication can prompt other conversations. What's going on with their memory? Do they realise how many of the medications they're missing? Are they just putting in a repeat prescription for all the medications, and therefore they might have a cupboard full of medications that they're not using, they're not taking? So it opens up a whole dialogue. By involving the patient in the conversations around the medication and stopping that medication, getting the pharmacists involved, just stops all of that happening. So it's a way of picking up what's going on with the patient, why it's going on, what are the reasons they are not taking their medication or not requesting their medication. So it just gives you a better, it's a simple question that therefore leads in so many different ways.
The problem that we were trying to solve was that when we went into people's houses on routine visits, we could see that there was excess medication in their homes, and we wanted to work out why people had that excess medication. And there are lots of reasons for that. The risk around the excess medication is patient safety. There's NHS resources that are being wasted, and there's also an impact on the environment. The excess medication is just one part of the jigsaw when you look at someone that fits into a big puzzle, and it's that whole care for someone. It's a comprehensive assessment. So we look at their medical needs, their medication, we look at their care needs, their cognition, their function, and also their social needs and who's looking after them. And it may be that when you look at their medication, that you can find that they take their medication Monday to Friday and they're not taking it at the weekend, which is sometimes because they don't have carers going in on a Saturday and Sunday. It might be they need prompting with their medication. It might be they have side effects with their medication. It might just be something simple like they don't have the transport to stop them from getting to pick up their medication. So all these things impact on people and on their well-being and can mean that they end up in hospital as well. So we were trying to look at the big picture to try and work out how we can support patients. But we also found that it helped to build the teams that we work with. So we work in the community, we work as a neighbourhood team, and at that point there were the pharmacy teams that had started work in primary care. We also work with adult social care, we work with community district nurses and rehab teams, and by having a project that we all worked on together, it felt that it really built the team. It was something tangible that we could look at, and that helped with showing the surgeries how we work together, and it helped work across the systems into the hospital, into secondary care as well, with the main goal of looking after people but also for team building and well-being. So how we worked the project was we used community staff on routine visits to look at people's medication after we talked to them on how to do that sensitively with people in their homes. So district nurses going in will have a look to see if there's a pack of tablets, or multiple packs of tablets, or a cupboard full of medication, and then they will alert the complex care team, the neighbourhood team, as to what's in the house, and then we would work out the appropriate person to go and visit that patient and try and work out why they're not taking their medication. There's lots of successes that we've come across that we've found that relatives have also said thank you for coming in. We've in the first 40 people that we identified that weren't taking their medication correctly, we came across 1,049 months of medication that wasn't being taken correctly, which worked out at nearly £11,000 spent, and as you can imagine, quite a lot of carbon emissions that goes with that. We stopped 39 drugs. We picked up cognitive impairment in 35% of those first 40. We did social prescribing for the first 30%. We also simplified drug regimes. So we looked at the patient and we adapted their medication regime through the day for them and their support that they had going in to make things simpler. And 50% of that 40, we altered the drug regime, which also has some impact on care packages. So if we work across the system better, then we can help support all the other agencies as well.
The Show Me Your Meds strategy has made a huge difference in the thinking of how you support a person. So medication is one of the areas that is quite difficult for an individual person. It can have a huge impact on the healthcare that a person requires, and it also has quite a financial strain to the NHS. Through my work and that of the team, the smaller team that I work with in the hospital, we are ensuring that people are going out of hospital on the right medications. The Show Me Your Medications is just a small part of what we do, but it helps the patient first and foremost. It also ensures that the doctors are prescribing correctly, and in turn it reduces additional healthcare needs based on people either inadequately taking medications or taking medications that they don't need. So yeah, overall, it's proving to be hugely beneficial for the patient and for healthcare.
So when I've been to visit people, it became very obvious that even though they may have spoke to the GP and said, yes, I'm taking my medication, we have a look and the blister packs come out, and within that blister pack, it could be the Monday and the Friday's taken, but not the later in the day or not earlier in the day. And then when people have gone to hospital, all of a sudden they've given all their medication in the correct order and up to the total amount. So when they came home from hospital, which is when we may pick them up again, that could have impact then on suddenly no medication and falls and going back to hospital, failed discharges, all sorts of things that could very simply be changed and improved. To the people we visit, it can make things so much easier to remove all the medication that they're overwhelmed by, and just to clarify what they need here and now. I think, and to the families as well and the carers, just simplifying everything. If we put it down to just once a day, or if we're able to move it to when the carer actually attends so they can prompt or just oversee. I think it's just releases an anxiety that many people we see have over their medication.
The main example is that patients really value talking about their medication, talking about what it does for them, why they're on it, how they feel about being on it. Often if they're not taking it, it's a good way to ask why. Why are you not taking it? What do you think the benefits are around not taking it? What do you think the benefits are around taking it? So you get the patient becomes more of a part of their medication and why they're being prescribed that medication, and their input is invaluable. I just think, that the Show Me My Meds and the complex care team getting involved is just so beneficial. It brings in a real joined up working. So the surgeries are talking to us, we're talking to the surgeries, we're all talking to the hospitals. So complex care is real joined up care, and I think that benefits all that are involved with the patient, but predominantly the patient.
Being part of the complex care team, I think that really bridges the gap between the hospital and the community. So actually seeing patients in their own home, you could really gain an understanding of what the environment they live in and how they're functioning within that environment. But also having that link with the hospital is quite unique. So having that really seamless approach from primary and secondary care and really delivering quite proactively what really matters most to patients.